Healthcare costs in retirement are more significant than people think, and we're not doing a good job planning of it. And I'm going to talk about why. I'm Derek Mazrell with Gateway Financial Partners. Let's check out healthcare and retirement. So, the most alarming stat I found is that 56% of people have no plan at all for healthcare costs in retirement. And not only that, we actually greatly underestimate healthcare costs in retirement. So, the annual healthcare costs that people think they spend is $2,700 a year, when in reality, it's $6,100 a year. So more than double what people think healthcare is going to cost is what it really costs. There's a couple reasons for this. So we need to break it down in two categories. The first category is routine care. So what actually goes into routine healthcare costs? Well, it's going to be pretty simple and obvious. The first one is your health status. Are you horrendously overweight? Do you smoke? What other health issues do you have? If you have a lot of health issues, you're probably going to spend more on healthcare in retirement. No surprise there. The other piece is location. So a doctor or hospital in Alabama is probably going to cost less than a doctor or hospital in New York. The type of medical plan you're on can also be impactful, and this is where talking to someone can really help. So there's really two main types. There's a Medicare Advantage plan, and then there's traditional Medicare. They both have their pros and cons. Medicare Advantage tends to be a little bit cheaper, but the network tends to be more restrictive. Now, traditional Medicare, on the other hand, tends to be more expansive, but also more expensive. So definitely talk to a Medicare expert and figure out which types of coverage makes the most sense. Because while you may save some money on premium, if you're unhealthy and you go to the doctor a lot, you may actually be paying a lot more on the back end in terms of healthcare costs. So it's really important to weigh those two decisions based on your actual individual health plan, because every healthcare plan has very different types of coverages. The other piece that goes into Medicare, most people aren't aware of this, is your income. So they look at what's called IRMA, and Medicare just because your premium based on how much money you made. And they look at your money you made on your tax return 2 years prior. Okay. So based on what bracket you're in, the lowest Medicare premium as of 2024 would be 174.70, right? But if you see even going two notes down, you're pretty much doubling the cost of Medicare if you're just in a higher bracket. And they look at something called your combined income, and they look at everything from your income from your annuities, income from pension, income from Social Security, income from your IRA or 401k distributions. They'll even look at things that aren't taxed. I get this asked a lot, like muni bond income. You pay no federal taxes on it, but does count towards this calculation for your Medicare brackets. So there are three main categories of items that actually are not taxed, but can be considered income in retirement. So things like Roth IRA distributions, they don't count towards this calculation. Any money that comes from an HSA reimbursement doesn't count, and typically money from loans. So the most common one is going to be like loans from a life insurance policy. A lot of retirees will use life insurance loans as a source of tax-free income. Guess what? It also doesn't account towards your IRMA bracket tax brackets. So it's very important to know and to plan what income sources you have in retirement, because that can actually greatly impact your Medicare premiums later on in retirement. Now, the other piece of this is long-term care. Most people know someone that has had to go through a long-term care event, right? Whether it's an aunt, an uncle, grandfather, parent. Most of us have seen one, either that's staying at home or getting care in a facility. In reality, according to longtermcare.gov, 70% of people, or there's a 70% chance that you will need some form of long-term care in retirement. And a typical long-term care event will last over 2 years. Okay, so it's very important to be aware that this is a real possibility, and you want to make sure we're planning for it. Now, here's just a look at some of the costs as of 2021 for different types of long-term care aids. So we have in-home care, in-home health aid. So in-home homemaker is going to be someone that just comes and has to do some cleaning for you, doing your dishes, maybe prepping some meals. In-home health aid is typically going to be some type of nurse or something that a little bit more on the medical side that's going to be more involved with your care. Then there's adult daycare, assisted living, and then actually full-blown nursing home. As you see, the costs vary greatly, but even the smaller end in the homemaker side is almost $5,000 a month just for that. just have someone come in and help clean your house and take care of you and do things around the house. Um, and depending on the state, see the difference between New York and Arkansas here is almost $1,400 difference there. So as you see, planning for your care can mean a lot. You say, hey, look, I'm only 50 years old. I don't care about this now. Well, if we look out 2051 with a normal Medicare inflation rate, you could be looking at paying 17,000 a month for in-home care and up to $25,000 a month for a semi-private nursing home room, and 40,000 if you're in New York. So where you live really can matter. And these are really big expenses that have to be covered on a monthly basis, and that we need to have a plan for them because you're not just going to typically pay out of pocket for them. So what are the things we can do about it? Well, we have to research the different Medicare options, see what type of coverage makes sense for you. You have to manage your income sources in retirement and pay attention to your IRMA brackets because you want to make sure we're keeping that bracket low if we can help it. Review your long-term care options. There's self-funding it. There's passing it off to insurance care. There's a whole slew of options. In my next video, I'll get into talking about how to deal with long-term care. But for now, these are some of the main things you should look at. I'm Derek Mazzarella with Gateway Financial Partners. What are you doing to take care of your health care and retirement?